My name is Carina Jowett. I am a Florence Nightingale Emerging Leader Scholar from 2019. So I qualified as a nurse in 1998 and I've worked in a variety of clinical settings in primary and secondary care. I'm currently working for a charity as a clinical nurse specialist in palliative care. And I've specialised in palliative and end-of-life care for a number of years now, working with adults with cancer or non-malignant conditions at the end of their life. And I've had the opportunity to advance my practice in physical assessment and prescribing. So as a senior nurse, I have a real privilege to be able to really make an impact on patient care. And I feel so completely passionate that as nurses, we should all be doing that, and we should be having such an impact on those around us and wanting to be able to lead those around me to also have positive and timely outcomes for their patients. I feel like I am a solution-focused person that is always looking to improve practice. My Florence Nightingale Scholarship has been completely multi-layered for me. I have had the last couple of years of learning about myself, both personally and professionally, and I hope that it has brought positive changes. When I applied for the scholarship, I came away from my interview feeling like it was the biggest mistake that I had done. I felt like such an imposter. I was interviewed with 3 amazing nurses and I listened to what they were doing and how, you know, their story of going forward, and it made me feel really inadequate and that what I was doing wasn't good enough. And so one of the big journeys for me has been able to recognise the leader in me and what that looks like and what it means. I have had to tackle that imposter, and that's probably the biggest thing that I will take away from this whole experience. I am not a manager, I'm not a team leader. I am a senior nurse who is able to make good decision making and timely decision making for my patients, and my passion has always been about being able to bring other people into that and share that and help other people do that, and wanting senior nurses or nurses in general to be having such an impact on patient care, because we live in a world now, or in a time where doctors they're stretched, they are completely everything is looking different for them, and we need to be stepping up. And for me it was about, how do I do that, and how do I lead in this time, in this age for nurses? So that was my passion, and I didn't really know what that looked like, and I think that now I do, and I think that journey has been so important for me. So I've had the opportunity to do improvement projects, which has been great from the governance side of things, and just that whole, what do I need to do to be able to bring people together? And I'll speak about that improvement project in a moment. The experience of the scholarship has given me the opportunity to spend days at RADA, which was an amazing experience, and do a leadership program with the King's Fund, looking at building my own authority within my own role, and that the learning from that just keeps coming. It's like something that at the time was just so completely saturating, and it's over time that the learning from that is just seeping out. The other part of the experience of the scholarship has been, without a doubt, the other scholars who keep you going, they motivate you, they inspire you, and they have become friends for life, and that that networking and that opportunity has just been incredible. My improvement project came about from an external service review of our team. One of the things that was highlighted in that report was the inconsistency in the way that we were documenting our assessments. So the quality and length of our assessments and plans was all a little bit different within the team. We were all doing something slightly different. The other thing that was highlighted was that some of the non-prescribing nurses were not always providing clear rationale and evidence for their history taking or for the prescribing decisions that they were recommending, and making it much more difficult for enabling prescribing colleagues to make decisions based on their assessments. So the idea was that I would lead a piece of work to help standardise the way that as a team we were approaching our documentation and evidencing our practice, and evidencing our specialist and advanced skills, so that we could be succinct and we could make it much easier and safer and quicker for our colleagues to find information. So we did that. So I led a team of people, and between us we formulated a new template on our medical records system to help pull all the information and find it in one place, so that it was really clear, and it wasn't a care plan. It was a piece of work that evidenced our advanced practice, that we were going to make it really quick and succinct to be able to all be thinking at the same level and documenting at that same level, and documenting the multidisciplinary discussions and decision making, so that we could make it so much easier for anybody to pick up those notes and get a really good, clear picture of what was going on if they didn't know that patient. So we did that, and it wasn't just a success in our team, it was something that the doctors felt was really valuable for them as well. So they also used that, and we're all, so as senior nurses and along with the medical team, we're all documenting and evidencing our information and our decision making in the same way. And it's very succinct. It's made a huge difference in the time of the pandemic, but when we've had to be really quick and snappy and find that information really quickly, and we've been reduced on staff numbers. So it's had a really positive impact on that. So, and it's felt quite privileged that the medical team have wanted to take that up as well. So alongside that has been the formulating of the operational standards and the systems that go with that, so that all that learning that brought, so it has helped to reduce harm to our patients and harm to ourselves professionally, because it protects us, it protects our decision making and gives us rationale for why we're doing things, evidencing it really, really clearly to keep our patients safe. I truly believe that the impact of this scholarship is going to be with me forever. The learning is just going to keep on coming. This has been such a bespoke scholarship and so truly individual for me. It's been easy to compare with other people, but that's not been the right thing to do. Because it's my journey, it's been my experience, and we're all so different. We will have all got something really different from this experience, and we'll all be going at different paces. For me, this scholarship has really helped me to develop my own understanding of myself and my triggers and my defences and how they impact on other people. And the impact, what do I do about that? How do I change what I'm doing to make sure that I'm getting the best out of other people because of my behaviour? It's helped me to really understand the diversity and complex in teams and other leaders, and sort of like, because people lead in different ways, it challenges your own leadership style and how you respond to things. So it's just such an ongoing process for me to be able to work within boundaries, to be professional, to deal with uncertainty, anxiety, the anxiety of change, and how you take people with you through that, and not get stuck, and you lead within that time of uncertainty. So that's one thing that's really impacting on me. I think that I've spoken about it before on a previous slide about the whole imposter syndrome and managing that imposter. That imposter will probably always be with me. I think that she might not go, but I certainly believe in myself, and I believe that I have a place and that I can do this and I can lead. It's completely pushed me out of my comfort zones and making me feel more comfortable in very uncomfortable situations, and given me the tools. This is what that scholarship has done. It's given me a toolbox that I can dip in and out of to be able to manage different situations at different times, but it's a continual learning process for me. The future for me in 2021 brings the start of new opportunities. So I will be leaving my current role in a couple of weeks' time to take up an advanced nurse practitioner job back in the NHS in an intermediate care unit. It's so exciting. I get the opportunity to take with me all the learning and the experiences of the last 2 years and apply it to a new role and to a new leadership post. And I am so looking forward to that. I think that, overall we are all unique, and I genuinely believe that if we bring the best version of ourselves to everything that we do, we will see a positive impact. And I so thank you, Florence Nightingale Foundation, and my sponsors, NHS Health England, for sponsoring this opportunity. It has been literally the most privileged and amazing opportunity, and it will be with me forever, and I thank you for that.